If you've ever been told you have low iron, you may wonder what you can do to speed up the process of restoring your levels. And more importantly, how to keep your iron where it needs to be for long-term health. Some people are more at risk than others. Women with heavy menstrual bleeding can lose significant iron each month. Pregnant women need extra iron to support their own body and their baby's growth. And people with digestive issues like celiac disease, Crohn's, or stomach surgeries may struggle to absorb iron at all. And that's where vitamin C comes in. Stay tuned. Welcome to the channel, everyone. My name is Gary Carlson. I'm a health researcher with a full-time practice in musculoskeletal medicine. I make health videos to help you live your best life. So first, let's talk about iron itself. Iron is an essential mineral that helps your body make hemoglobin. That's the protein in red blood cells that carries oxygen. Pretty important. Without enough iron, your body can't make enough healthy red blood cells, and that leads to iron deficiency anemia with symptoms like fatigue, weakness, pale skin, dizziness, easy bruising, and poor concentration. Dietary iron comes in two forms. Heme iron is found only in animal products like red meat, chicken, and fish, and it is absorbed more easily. Non-heme iron is found in both plant foods and animal products and is harder for the body to absorb. But here's the surprising part. People on plant-based diets usually still have normal iron stores. Why is that? It's because most of the iron we eat, whether we're vegetarian or not, actually comes from the non-heme iron pool. So even though non-heme iron is harder to absorb than heme iron, we eat much more of it than heme iron. And this is where vitamin C comes in. Vitamin C, also called ascorbic acid, converts non-heme iron into a form that's easier for your intestines to absorb. Without enough vitamin C, much of that iron would just pass through your system unused. So think of iron as a guest trying to get into a party. Vitamin C is the friend at the door who makes sure their name is on the guest list and gets them inside. So where do we get vitamin C? Of course, citrus fruits like oranges, grapefruits, and lemons are great sources. But there's lots of other sources like strawberries, kiwis, bell peppers, broccoli, and leafy greens like kale. But one thing to keep in mind, heat destroys vitamin C. So eat fruits and vegetables raw when possible, or use quick cooking methods like stir frying or steaming. And if you're already taking an iron supplement, your doctor may suggest adding vitamin C to make it work more effectively. That's why some iron tablets even include vitamin C. It can also help reduce some of the side effects of iron pills like nausea or constipation. But like anything else, more is not always better. There are definite risks with taking too much iron. And high doses of vitamin C, especially from supplements, can cause stomach upset, diarrhea, or even kidney stones in some people. The takeaway is simple. If you're low in iron, combining iron-rich foods with vitamin C-rich foods is a natural way to improve absorption. But if you're dealing with persistent low iron or anemia, check in with your healthcare provider. You may need supplements or other treatment in addition to simply adjusting your diet. Thanks for watching, and be well.